Hello, my name is Daniela Verde Soto. I am a student medical at University of Santiago de Guayaquil. The topic the present to be is antimicrobial prophylaxis for the children with vesicoureteral reflux. Its definition. The vesicoureteral reflux is the abnormal, the flow of the urine, the bed from the bladder, the blood, the two ureters that connect to kidneys to the bladder. Its video.
Vesicoureteral reflux is the retrograde flow of urine from the bladder up to the kidneys. The tubes that drain the kidneys are called ureters, and actually the urine flows from the bladder up to the kidneys via the ureters. So there's various ways we diagnose children with vesicoureteral reflux. One way is with antenatally detected hydronephrosis, that's swelling in the kidneys that's detected on the prenatal ultrasound. The other way is when a child has a febrile urinary tract infection, which prompts evaluation. Symptoms of vesicoureteral reflux can include febrile urinary tract infection, as well as findings on imaging such as swelling in the kidneys and ureters. Treatment options of vesicoureteral reflux include surgery as well as a procedure to increase the tunnel length of the ureter and the bladder. Surgery includes actually lengthening the tunnel of the ureter into the bladder surgically to allow a good flat valve mechanism that doesn't allow the urine to go up to the kidneys. A procedure called dextronomer hyaluronic acid injection is done cystoscopically, and this also can increase the tunnel length. Ureteral reimplantation is the surgical procedure to treat vesicoureteral reflux. In children that are on prophylactic antibiotics and get breakthrough infections, in other words, they're getting infections when they're taking their prophylactic antibiotics appropriately, we actually want to treat the reflux to prevent scarring of the kidneys. This includes a small incision in the lower abdomen to reimplant or make the tunnel longer of the ureter into the bladder, thus treating the reflux. Ureteral reimplantation is a surgical procedure to lengthen the intramural tunnel of the ureter and the bladder. This is done through a small incision below the bikini line called a fan and steel incision. The procedure itself takes about an hour and a half to do, and recovery is usually about a day or two in the hospital postoperatively. Not all children with vesicoureteral reflux are candidates for reimplantation. We usually observe these children and see if they can outgrow their reflux prior to proceeding with surgery. Your child should have this procedure done at the Johns Hopkins Children's Center if they need it, because we have world-class experts that are experts in this type of surgical management, as well as the medical management. We have a wonderful multidisciplinary team that includes not only the pediatricians, pediatric urologists, and pediatric nephrologists that will care for your child.
Its application. The application. Initial the treatment the source be conservative with the general hygienic the measure. The drug antibiotic, the prophylaxis, the be restricted to high risk the growth, such as the presence of the dirty BUR of the recurrent febrile urinary tract infection, UTA. Pros and cons. Pros. With the strategy of the conservative maintenance of the children with PUR in the addition to the application of the general hygienic measure. Propose at the energy at the early the treatment of the incurrent urinary tract infection. Episode the use of the repeated for the low close of the daily antibiotic, and the simple the regimen has been used extensively to prevent recurrent urinary tract infection. The cons: the bladder and the bowel dysfunction. Children with DEVD urine are stored and experiencing recurrent urinary tract infection, which can contribute to vesicoureteral reflux. The risk: with children able to be at a higher risk for vesicoureteral reflux. The sex: in general, girls are the much higher risk for this condition than boys. The exception is vesicoureteral reflux that is present at birth, which is more common in children.
Vesicle is another name for the bladder, ureter are the tubes back to the kidney, and reflux means backflow. Urine is produced by the kidneys and travels down the ureters to the bladder. Normally when the bladder contracts, the valve shuts and all the urine comes out one way. With reflux, the ureter and valve has not been formed properly, so the urine goes back up to the kidneys. When the bladder relaxes, the urine comes back down again. Reflux makes urine infections more common as there's always stagnant urine floating around. Reflux can be graded 1 to 5. Mild reflux is grade 1 and 2, where the urine flows back up but the ureters are not dilated. Most children will grow out of this mild reflux. In severe reflux, the ureters are very abnormal and are always dilated. There's more urine left in the system and urine infections are more common. With reflux, sometimes the kidney itself is also abnormally formed and may not fully work properly. This is called dysplasia. Reflux can lead to kidney damage if the urine becomes infected and gets carried up to the kidneys. This is called scarring. Getting treated early with antibiotics can help reduce scarring. As children grow and the ureters mature, many children will grow out of their reflux, especially if it's mild.
The conclusion: antimicrobial use the prophylaxis the source be adapted to local the bacterial sensitivities and so be changed periodically to avoid the emerging of the residents. Thank you.